Hello, ako si Judas Cavillan. Kayo ay nanonood ng bagong episode ng Newsbreak Beyond the Stories kung saan hihimayin natin ang mga maiinit at mahalagang isyu sa Pilipinas. Sa episode na to, pag-uusapan natin kung kamusta na ang vaccine rollout sa bansa. Halos sa isang taon na rin simula na mag-umpisa ang pagbabakuna sa mga Pilipino laban sa coronavirus. Ngunit marami pa ring rehiyon ang hirap na maabot ang kanilang vaccination target. Saan nagkukulang ang gobyerno sa pag-rollout ng vaccines? Ano ang posibleng epekto nito sa laban ng bansa laban sa COVID-19? Tatalakayin natin ang isyong ito kasama si Sofia Tomacruz, ang rapper reporter who covers the government's response to the pandemic. Hi Sofia, thank you again for joining me today.
Hi, Judes. Thanks for having me.
So bago tayo magsimula, I would like to remind our audience na pwede silang magtanong. Just comment down below and we'll try our best to answer your questions or address your opinion about the issue that we're talking about. So Sofia, first question ko, kamusta na ang vaccination numbers natin ngayon as a whole country? Can you give us an update?
Sige, Judes. Tama no yung sinabi mo kanina. It's been almost a year since we started vaccinating against COVID-19. If you recall, March 1, 2021 yung start date natin, no? So, I don't wanna drown everybody in the numbers. Dami-daming numbers na, baka litong-lito na yung mga tao sa mga numbers. So, I'll just mention a few that really matter. And there are three. So, first being that roughly 54% of Filipinos are fully vaccinated against COVID-19, and this is the total population. So 54% of the total population is fully vaccinated. Roughly 65% of seniors are fully vaccinated, and about 9 million people have gotten their booster shots. So
Yes.
that's the lay of the land right now.
Yes. I remember when you first talk about the vaccine program. I think that was last year when we're talking about targets. You mentioned this parang mga time period like dapat at this time 60 or certain number ganito ganito. So my next question would be itong progress natin ngayon at least 50%. Is this the normal phase or is this at par with what we envisioned in the past year or things could have been passed faster?
Well, yeah, things could have definitely been faster, no? So if we just go by the government's own targets, kung naalala natin, the officials wanted to reach 70% of the target population by the end of last year. Um, 70% of the target population, so 70% of the 70%. And they missed that. We only achieved that early this year, sometime in January, when 54 million Filipinos were vaccinated. And now we want 70% of the entire population, so yung buong target population, to be vaccinated by March. But it's questionable if that can be achieved at this point. Kasi base sa pace, sa vaccination pace natin ngayon, um, according to tracking by Reuters, they showed that it will take around 61 more days to administer enough doses for another 10% of the population. So, going back to what I said a while ago, if we're 54% fully vaccinated right now, it'll still take around 2 more months to bring that up to 64%, which is around April or early May. So it's a questionable, it's still a big question if we'll be able to reach a 70% by March. So
Yeah.
we could be going a lot faster, yes.
Related to that question then, no, you have this story on the vaccine rollout. I think this was last week or 2 weeks ago. And you pointed out very concerning facts. Can you tell us about these, particularly yung about sa distribution of vaccines? Kasi as someone was not focused or hindi kami tuloy sinusundan yung vaccine rollout, I would think na from the outside, especially the public, I think na baka problema pa rin yung vaccine. Number one problem natin yung vaccine status, ayaw magpa-vaccine ng mga tao. Pero ano yung nakikita mo dun sa so far sa data na binantayan mo, Sofia, regarding sa distribution ng vaccines? Parang ito yung ba yung uh, major problem natin?
Mhm. Right, so itong recent story natin sa Rappler, we wanted to analyze yung vaccine program beyond yung mga figures na binanggit ko kanina, for example, yung 54% fully vaccinated and everything. So, precisely to find, yun nga, ano ba yung mga issues ngayon, lalo na 1 year in the vaccine, we're 1 year into the vaccine program. So, really what we found was that if supply was the really big issue last year, where for the most part of the first 10 months, a lack of doses held back any possibility of us reaching our targets. this time around, it's really the lack of access. So, in the two-part story that we did with public health research firm Epimetrics, we found that, for example, there's one graph that was very telling. It had three curves. So the first curve was the number of people who were confident about getting vaccinated. Mataas yung curve na yun kasi tumataas talaga siya over time, and that's something that the government has recognized and has bannered and boasted in many headlines. And granted, it really has been increasing. And then at this point in time, we already have enough supply for 100% of the population. Pero ang laki pa rin ng gap ng between the number of people who want to get vaccinated and the people who are actually vaccinated. So that tells us that right now the biggest problem that we have is access. And you mentioned a while ago, Judas, isang related aspect doon ay yung uneven distribution of doses across the region. So, granted, some regions will get more than others because of the population size and everything. But we see that the uneven distribution is also a product of different degrees of the cold storage capacity of these regions. At meron ding factor na may decades old problems in the health system that are coming forward again today in this vaccine program, like the lack of health workers, the lack of barangay health stations in especially in provinces, and then isolated in rural areas. At pati na rin yung lingering hesitancy in some sectors, although it's been going down, may mga konting vaccine holdouts pa rin. So these are some of the major issues that we found were still present, but the biggest really being access and an uneven distribution of doses.
Yeah. You mentioned na kanina a bit 'to, pero I wanted to ask also, paano ba nade-determine yung kung anong regions yung makakakuha ng certain number of doses? Sino ba ang may final say dito? Kasi, if you're coming from Manila, you'd think na ang dami-daming doses sa Manila, pero iba pala ang sitwasyon, ang realidad sa mga ibang mga rehiyon sa labas ng Manila, sa labas ng Luzon. Paano ba nade-determine kung ilan ang bibigay sa isang region at sino ang may final approval ng sistema nito?
Right. So kung naalala mo, Jades, early on in the vaccine program, I think it was around around this time last year, before the first doses started arriving actually, 'di ba may prioritization framework. So yun yung parang A1, A2, A3, A4, A5, health workers first, tas sunod sa kanila yung mga seniors and so on and so forth. But alongside that prioritization framework by sector, we also had the government also prioritize distribution of vaccines geographically. So we saw that um, the richer, more productive regions were the first ones to get doses. They were first in line, while the poorer and less productive regions had to wait a little longer. So this is something that they have said quite explicitly, I would say, kasi sa mga NCR plus 8 plus 10 groupings, um, uh, isang dahilan kung bakit nakasama yung isang key city or an area in that grouping was because of their economic impact and contribution to the country. So, um, that we saw that that impacted the way that vaccines were distributed, and because but you can also argue, of course, that these prioritized areas were first because they had higher cases, they were densely populated, and so you could argue, of course, that it was necessary na sila dapat yung mauuna. But to a certain degree, um, you could also say because of that, the prioritization of framework kung saan dapat nauuna yung mga health workers and then the seniors and then the high risk also wasn't followed to a certain degree because you know, you could have prioritized all seniors throughout the country, and then you could have prioritized all high risk individuals throughout the country. But we saw that because there was that dynamic, then that wasn't always the case. So, pero isa pang factor sa pagdidistribute ng doses is also um, exactly that, what we said a while ago about the storage capacity, the cold storage capacity of regions. So, that varied, of course, per region and on a more local level. Kasi diba alam naman din natin na yung local governments talaga yung responsible for the administration of these shots. And so what the government did when when they partnered with the private sector is that they had this system called Days to Last, where local community, it's essentially a way to measure how fast LGUs were giving out doses. So the supply of a community is tied very closely to how efficiently they're able to roll out those doses. So kung mabilis sila, then mabilis din ma-replenish yung stocks nila. So pero yung isang problema dun naman ay paano naman yung mga areas na kulang yung mga tao or kulang yung mga vaccination centers? Kasi historically, mababa talaga yung investment in health sa mga communities na yon. So the problem with that system also is that these areas that have a hard time rolling out doses are also the areas that have the least room for error kasi limited na from the get-go yung health capacity nila, ilan lang yung mga hospital beds, let's say, pero sila din yung most challenged in a way. So I think dun din yung tension, which is why it's hard to say sino ba yung may final say. Kasi
Yeah.
sasabihin naman ng national government, kasi mabagal yung LGU na yun or yung community na yun. Pero nahihirapan naman din yung community na yun kasi yun nga, kulang yung tao, kulang yung mga vaccination
Yeah.
sites. So it's hard to say who has the final say, but those are some of the factors that dictate how doses are distributed throughout the country.
Para siyang chicken and egg problem, no? Kasi nga, nagsisisihan sila pareho. Pero, looking back, Sophia, you mentioned parang several systems na parang pabago-bago sila, nag-a-adapt sila palagi, di ba? You mentioned several systems pagdating sa distribution of vaccine. Looking back, based on your coverage and also your conversations with experts, do you think they could have done something better sa sistema na to? Parang at the beginning pa lang, dapat maayos na sila. What are experts saying about the systems that they put in place? Parang may miss opportunity pa silang ginawa.
Mm-mm. Well, I think first, this is precisely the scenario, first of all, that experts wanted to avoid. Kung naalala mo, 'di ba may time na nasa news yung issue about the local governments buying their own doses. And I think
Yeah.
one valid question that was raised in that was how about poorer LGUs that don't necessarily have the extra funds to uh, secure their own vaccine deals. So initially, a lot of health experts were saying na dapat um, dapat bawal yung ganong setup na yung LGUs also buying everything. But and of course, as a side note, eventually we know that it was approved, that kind of setup, sa tripartite agreement. But they were against that at the outset because they were saying this is precisely going to see the situation where um, the ability to vaccinate is tied to the ability of a person to pay, and
Yeah.
which won't be very equitable, right? So we're seeing that play out somewhat, but just in a different way, in the sense na parang um because the lesser productive regions were had to wait longer, we see that it's led to more inequity, really. And
Yeah.
that's what a lot of experts are pointing out. In poorer regions, communities that had to wait longer for vaccines
Yeah.
were already those that have been historically disadvantaged na um taon-taon na lang sila pa rin, for example, yung poorest region
Yeah.
or poorest community. So to quote Dr. John Wong, an epidemiologist who we worked with for the story, sabi niya, that was like saying that system that you had in place was like saying that you had more value if you were productive. And what does that, I think that leaves us with the question of what does that really say about, yung campaign natin to quote unquote leave no one behind.
Yeah.
And how is it any really different from what we were doing when we were calling out richer countries who got first dibs on vaccines, diba? Sinasabi natin na medyo unfair yun kasi of course kayo yung nauuna because you have more money. So
Yeah.
it's the same thing happening sort of just on a more local scale.
Very capitalist society, no, but that's for another longer discussion.
Yeah.
Pero with all these expert opinions, hindi naman nagkukulang sa expert opinions about the system that they put in place in the beginning, especially during those times na yung nakikita yung na nauuna yung mga may kayang mga LGU, bakit hindi nakinig yung national government? What held them back? Or are they seeing something that experts, the media, observers are not seeing?
Um, I think, well, I think first there are gaps on both sides. So for example, hindi lang ito kasalanan ng national government, at the same time hindi lang ito kasalanan ng LGUs. They both have roles to play in the national vaccine campaign kasi um 'di ba, it was really a job that tested the competence of every single government agency, I would
Yeah.
say, kasi lahat ng government agencies um active sila dito. Pero I think it's worth pointing out also that it's not what we're seeing now isn't really a product of the last 2 years alone of the pandemic or going into three now. Pero it really goes back to the neglect that several administrations have had for um when it comes to investing in our health system.
Yeah.
And that's a job that's not just for the national government, but also local officials. Kasi nga, di ba, na-devolve yung healthcare, let's say, primary healthcare to the LGUs. So, um, but if we're looking at the pandemic alone, we should also take note of the fact that we had more than a year um, to ramp up our storage capacity. Yung mga cold storage needs ng iba't ibang rehiyon, local on the provincial level as well. So, and we also had enough time to draft plans to get doses to areas where we knew there would be a lack of health workers. We knew na kulang yung mga barangay health stations, for example, and also a way to maybe figure out how to fill in those gaps in personnel and in manpower. But at this point in time, we're still struggling. No? So I would say that may kulang yung on both sides, the national government and the local governments.
Sophia, are we already seeing the impact or the effect of this unequal access to the vaccine, the very unequal distribution of vaccines in the regions? Based siguro sa numbers ng mga COVID-19 cases sa mga regions outside the Manila. Kasi in Manila, you'd think na dami ng tao sa labas. Sa Manila, di ba? Lagi ng pag-weekend, ang daming tao sa mga pasyalan. Pero when we look at the news, ang dami pa rin cases na tumataas sa ibang outside Manila. Do you think this is related to the fact na konti ang mga vaccine supplies sa mga probinsya?
Well, bumababa na yung mga kaso ngayon, 'di ba? Pero balik tayo sa panahon nung um, May surge, nung nagkaroon tayo ng surge driven by the highly contagious Omicron variant. So, um, when you saw that Omicron was spreading quickly throughout the country, nakita din natin na yung uneven distribution of vaccines across regions meant that and with all of these challenges that we've been talking about, the vaccination pace in most areas were too slow to have prevented what could have been avoidable deaths. No, were there more vaccines available in these areas? And we can see that, for example, when we look at Metro Manila, um, the vaccines really really cushion the effect of Omicron on our health system. So you're right. Sobrang taas yung mga kaso, pero granted that that Omicron was less severe compared to Delta, pero deadly pa rin. It also the high vaccination rates in Metro Manila made a huge difference when you compare the surge caused by Delta and then the surge that was also fueled by Omicron and how many people needed to go to the hospital. Um, vaccines played a big part there, and Epimetrics actually did an analysis of hospitalization of admissions during the Omicron surge, and they saw that cases in NCR were 60% less likely to be hospitalized compared to non-NCR cases. So I think that like with that figure alone, you saw the impact of the unequal distribution of vaccines throughout the country. And like I mentioned a while ago, yung impact din sa so if that was the impact in Metro Manila, the impact naman sa mga ibang provinces and regions that had less vaccines and had a harder time rolling out those shots was that their hospitals and their health workers were more exposed to yung sharp increase in cases during the Omicron surge. So it really leads to the biggest difference led to better health outcomes in places na mas marami yung mga bakuna. And
So
in
given, yeah, sorry.
sorry, and in that sense, because you mentioned about goals, right? It really just threatens to keep the our goals out of reach. For example, yung 70%, yung 90%.
So Sophia, very dire situation yung napinta mo sa mga data na meron, specifically dun sa story na nilabas nyo last week, 2 weeks ago. What are you afraid of what may happen basing dun sa data na sa situation na nakita natin na may unequal access to vaccine na? Paano if mag-continue to? Ano ito yung kinakatakot mo? Ano yung worst case scenario?
I think the worst case scenario is really na mapoprolong yung emergency phase ng pandemic. Kasi granted, may mga ibang responses din na pwede natin gawin. For example, yung masking, yung good ventilation, making sure that's in place, practicing social physical distancing. Sobrang effective pa rin yung mga vaccines in a way that these other health interventions aren't, because it really keeps you out of it literally saves lives.
Yeah.
And so and it also helps to lower transmission. So you also protect other people by doing these things. So I think yung worst fear, if you could call it that, is prolong talaga yung pandemic, and like all the other podcasts that we've had na Judes, that has an effect not only on people's health, pero yung mental health. I mean, not just physical health, pero yung mental health din nila. And then of course, the fact na nahihirapan pa rin yung mga tao when it comes to finding to working, having regular income. So, to have that emergency part phase of the pandemic be prolonged, their impacts it will impact all different things from work to education.
Yeah. I'm sorry, Sophia, pero I know you mentioned this na at the start of the program, pero can you remind us again, aside from the unequal vaccine access distribution, ano pa ba yung nakikita ninyong challenges sa vaccine rollout?
Mm-mm. Well, yung pinakamalaki, I think, and this is also what a lot of experts have been pointing out, is really the biggest or the largest issue we have to find. Everything is important. We can agree with that. Pero yung malaking issue talaga is the relatively low vaccination coverage among our seniors. Kasi we know now that age is just an entirely different puts you in an entirely different risk category na it's almost like I remember Dr. Salante, who's an the Dr. Salante, who's an infectious disease specialist at San Lazaro. He was saying that age is almost like a comorbidity. It really puts you in an entire different um, risk profile, and we know from looking at our cases and the data that DOH has na seniors, those above 60, make up 70% of deaths from COVID, from throughout the whole pandemic so far. And yet we haven't managed to vaccinate all 10 million or so individuals in this group. And that will continue to have big consequences on how big of a burden COVID is on our health system. And also, more importantly, these are millions of elderly who we haven't protected and who also need to be protected. So um, when we know also that vaccines are
Yeah.
life-saving, it's hard to wrap your head around the fact na may I said earlier, mga 65% yung covered. So out of 10 million, that's around 6 million or
Yeah.
so seniors. So may mga 4 million na lolo at lola pa rin na vulnerable to COVID-19. And it really is true that it is the most effective way to maximize the impact of vaccines. And we haven't done enough, I think, to raise the vaccination levels among that group. Kasi, um, isipin mo, sila yung A2 priority group, di ba?
Mm.
So, very early on in the vaccine program, they were already eligible. Yet, um, somehow we've lagged in this
Yeah.
area. And you can see also in different countries just how big of an impact really is to make sure that um, this group is protected. Kasi may mga countries na kahit tumataas yung mga kaso, minamanage pa rin nila yung increase kasi um, halos 100% ng mga elderly, ng mga senior citizens nila ay vaccinated.
Yeah.
So, I think that's the case in Portugal. So, even the slightest differences can have a huge impact. Like 99% versus 80 is sorry, it's not that small, pero 80 to let's say 82, malaking impact pa rin yung 2% na yun in terms of covering, of vaccinating your seniors. So I would say that's really some of the challenges that are still the biggest challenge that's still seen at this point in the rollout.
Bakit ang hirap magpabakuna ang mga seniors natin sa Pilipinas? You mentioned na hindi or kulang sa effort yung government sa pag-encourage. I'm curious tuloy kung meron bang parang mga studies or mga uh, research ang mga experts kung ano yung parang main concerns ng mga seniors natin pagdating sa vaccine.
Um, well, in terms of encouraging, I think um, kulang in a sense na parang um, nawalan nawala sila sa focus or it's only now na bumabalik sila sa focus ng national government kasi it for a while the government was very uh adamant about expanding it to different opening the vaccination drive to different age groups. And granted, of course, everybody needs a vaccine, everybody needs to be protected, pero we saw along the way that when we opened it to, for example, the entire adult population, and then later on to later on to 12 to 17-year olds, and now 5 to 11-year olds,
Yeah.
that number of seniors who are vaccinated, it has barely moved.
Yeah.
So they were out of the focus for a while, and you're asking about some of the reasons why it's so hard to vaccinate them. Actually, may nationwide study, independent study to ni Dr. Wong, who I mentioned a while ago, and really it goes back to access.
Yeah.
Yes, there are some seniors na medyo hesitant pa rin, pero yung the biggest hurdle really is still access kasi um I think he found some of the findings from that study were that the major obstacles for seniors when it comes to vaccination is um masyadong mahaba daw yung line sa vaccination
Yeah.
center. That's
Mm-mm.
one. And then another one being it's too far. The vaccination center is too
Yeah.
far. Or wala silang kasama
Yeah.
pupunta sa vaccination center. So these are access issues. And the way that the government is trying to address them now, I think is good na may mga house-to-house vaccination efforts. Pero it goes back to the old problems, right? Kulang yung mga tao,
Yeah.
can't do it every day kasi there are other things to do as well. So like you mentioned, it's like a chicken and egg situation.
Yeah.
But we really need to keep at it.
Yeah. Sophia, you mentioned ang daming challenges talaga na meron pa rin tayo ngayon. Yung access to vaccine, distribution, then kasama dito yung kakulangan ng mga cold storage facilities, kakulangan ng mga healthcare professionals na tutulong vaccinate ng mga tao kaya hindi magawa yung mga house-to-house na kailangan for the seniors. Parang logistical issues basically. At this point in time, magawa niyo tayo sa vaccine program natin. Ibang bansa parang maaabutan ng target nila, sa tayo slowly papunta pa tayo sa target natin. Are you still surprised or did you still suspect na lilitaw pa rin yung mga problemang ganito na nakita natin ngayon? Siguro looking back the beginning of the vaccine rollout, did you expect na 1 year into this program, same issues pa rin, lumalabas pa rin siya? I've guessed you a million times in this podcast, lagi mo mini-mention yung mga health, kakulangan na healthcare, kakulangan na logistics. Pero ngayon na mag-isang taon na tayo, andun pa rin yung problema nito. I mean, what can you say about this? Did you still expect na ganyan mangyayari? And I'm
Mm.
sure you're frustrated then.
Well, to some extent, yes. Kasi, again, we go back to, we can take a step back, for example, and think about how big this COVID-19 vaccination drive was. It was the biggest public health program ever in our
Yeah.
history. Um, you are not just trying to reach yung like mga 2 million kids every year that we try to do with measles and other vaccines. We're trying to reach, virtually almost the entire population, around 90%. And that's 90% for now, because we know that
Yeah.
later on it can go up to, I don't know, over 90%, almost 100%. So it really is the biggest um, public health program that you've had to mount, and it's highly complicated. Um, just to appreciate what it takes to mount this big vaccination program, you need like what we mentioned earlier, yung cold storage capacity na nag-iiba din, diba? Depending on the vaccine, and then it's also a different there are different ways to administer the shots. There are different times that you can keep the shots out for. When it comes to, I mean, you can there are different periods of time where you can only keep a shot out for this long until it's no longer usable, or nag-iiba din yung mga dosage, diba, ng kids versus adults. And also different schedules, 21 days, 28 days, 12 weeks. So um I think it's also impossible that everything would be smooth sailing. Pero um you know I and if we also take a step back and acknowledge na, okay, 54% is still, over half of the population protected.
Yeah.
Pero yung takeaway ko naman is there's always more to be done.
Mm-mm.
Um just because of how big this program is, there will always be ways to improve. And I think be it COVID or another disease, we'll keep also facing these problems if we aren't serious about fixing yung mga gaps sa health system natin, diba? So if we're talking about, I don't know, Judas, knock on wood, but we're talking about, let's say, another disease from
Yeah.
in the future, years from now.
Knock on
Kung
wood.
kung hindi pa sapat yung mga, kung hindi pa funded, for example, yung universal healthcare law, there's still no primary health services that are accessible by all Filipinos. Kulang pa rin yung mga health workers. Mas maganda pa rin yung pay ng health workers abroad versus the way they're treated here back home. We'll just be talking about the same problems again and again. So yeah, to be expected, but really, I think it just drives home the point more that we really need to be serious, take a serious look at fixing these issues once and for all.
Yeah. And for my last question, Sophia, napakadaming dapat pang gawin ng gobyerno para ma-address yung mga issues. Pero siguro let's give them a month. Ano dapat yung tatlo na dapat i-prioritize nila ngayon para ma-address yung mga, na-mention mo mga challenges sa vaccination rollout sa bansa? Siguro, three lang
Mm.
siguro, ano yung pinaka dapat kung bukas gawin na nila para maayos na.
Well, first of all, kailangan talaga makover yung gaps sa access. It's really the biggest issue right now, access. And we see naman na may ginagawa sila, for example, the rolling out vaccination through pharmacies. Better late than never, I guess I would say. Kasi that's a whole network you can tap, and you have pharmacists who you can tap, so that really helps. May house to house campaigns then, which is good kasi uh, it reaches people. We also saw, for example, so aside from those efforts of pharmacies and house to house, we also I think the second thing that they should pay attention to really is yung, again, going back to the seniors.
Yeah.
May mga 4 million seniors na hindi pa bakunado, and really at this point 4 million, really at this point, it will have a huge impact on our health system and the way COVID-19 impacts us if we can really cover all of them. A third, I think, really is going back to access. Um, this is something that we raised in our story as well with Epimetrics, that we can we can fix some of those gaps in access by having another national vaccine day. And I think yeah, right now we're having one, pero it's not to the scale of the first national vaccine day, where almost 10 million, if not 10 million, Filipinos were vaccinated, and that gave us a big bump in our numbers. So um you know I think that something that we can do to get us to where we need to go and to reach our goals. And lastly, if I can add, kasi tatlo na yun,
Yeah.
pero the last one, I think we really need to find a way to, at this point in time, help yung mga um lagging na regions sa vaccination, help them with their vaccination activities. I To be honest, I don't necessarily know exactly how we're going to do that, but then it's for all of us to figure out, right? But we really need to find a way to help regions with a lack of personnel and health infrastructure to vaccinate faster para protektado din yung mga tao doon. And these are areas like the Bangsamoro Autonomous
Yeah.
Region in Muslim Mindanao, and which according to Sec Galvez, mga 28% lang yung vaccination coverage nila. That's so How can that be the case when almost 115% na yung Metro Manila, right? And
Yeah.
over a
True.
year, almost a year into the vaccine program. You also have lagging regions like Mimaropan, Soxargen. So um, we need to be able to help those regions, because the same way we preach about equitable vaccine coverage around the world, the same needs to happen here.
Yeah.
um for other regions and for the entire country, if we're really all going to exit this pandemic.
So the government has a really long list of tasks ahead of them. But these are really important if they want to address the issues that we're still seeing a year into this vaccine rollout program as we enter the third year of the pandemic. Yun. So, maraming salamat, Sophia, for joining us tonight. Uh, napakadaming natutunan ngayon, lalo na sa mga issues na tingin natin ay surface level, baka ayaw na magpapakuna ng mga tao. Pero eventually, nandun pa rin problema talaga ng mga access and distribution. Dapat bantayan din natin. Dahil, hindi lang dahil taga Manila tayo, it won't affect us. Pero dapat, andun din yung compassion, yung empathy natin sa other regions. So, yun. Thank you, Sophia, for joining me this afternoon. This evening.
Thank
And,
you.
yeah. And for our viewers, kung gusto niyo sumali sa discussion natin ngayon, pag-usapan ang vaccines issues natin, ang pandemic sa bansa, pwede kayo sumali sa Facebook group na Raptor na sa Facebook. Well, tapangan nito ay Raptor Room. Makita niyo ang link sa comments section. At kung gusto niyo naman na pag-usapan ang pandemya in relation to the election or anything about the election, pwede kayo sumali sa Facebook group na Raptor PH Vote Room. And for our viewers, thank you for watching. Kung gusto niyo sundan ang issue na ito, huwag kalimutan na palaging bisitahin ang Rappler website. Don't forget to also like and subscribe sa YouTube na Rappler, pati na rin sa aming ibang social media accounts tulad ng Facebook, Twitter. Kung hindi niyo pa kami fina-follow sa Facebook, i-hit niyo yung notification button dyan o kung saan man kayo nanonood. Just make sure na para hindi kayo ma-miss ang mga episode ng Rappler shows. Samahan niyo ulit kami next week para sa bagong episode. Ako si Julius Gavilan at ito Newsbreak Beyond the Stories.